They do get paid more as they acquire skills and take on more responsibility. So there is also truth in that statement. The BBC News article on this topic, you can find the link in the transcript, gives the example of a junior doctor called Robert. He earns £29,384 per year and works in a London hospital. Now, it is possible to live in London on that kind of salary, but it's quite tight. You don't have a lot of money. He earns £3,117 per month before tax, and his take-home salary, that's when you've taken off all the deductions, is only £2,164. That's quite difficult to live on in London. Robert talks of wanting to move to Australia to be a doctor instead. He wants to leave the UK and the NHS. Another junior doctor quoted in the same article, Kiran, is further forward in her career. She qualified from medical school from university in 2011. Her pay is a little better, but still only £28 per hour. She works as a paediatric registrar or a children's doctor, looking after sick children. And she says, the vast majority of junior doctors at my level end up working extra unpaid hours before they can go home at the end of the day. I just can't leave a sick patient because it's unsafe. She talks about a decline in morale in the health service. And she says, this was not the job that I signed up for. First of all, just comparing these salaries with other professions in the UK. If you work in marketing in the UK, you'll earn between £25,000 and £52,000 per year. That's quite a lot more than a junior doctor. And you'd earn £27,000 a year as a warehouse manager. It's hardly the same level of responsibility. And nothing like the level of training and skill that the junior doctors need. The leader of the Doctors' Union, the BMA, Professor Philip Banfield, has talked also about how the problem is the waiting lists and the pressures that doctors are under. And this makes their working conditions poor. He said that waiting lists for treatment were getting steadily worse for 10 years leading up to the pandemic arriving. Now they're even worse. And in fact, it is these waiting lists and doctors being unable to do their jobs because of underinvestment, workforce shortages and rota gaps that lie behind the strikes they're being forced to take now. Rota gaps means that there are constantly situations where there are not enough doctors and other medical staff to cover the shift to be safe with the patients. Listening to some of our junior doctors being interviewed on the radio this morning, I think many of them are supporting the strikes because of pay, in part, but more because working conditions do not allow them to feel satisfied with their jobs. If you're motivated by altruism and you constantly feel that you're unable to do a good job, through no fault of your own, even if it's because the system is understaffed and underfunded, it's hard to keep your morale high and feel that you're doing a good enough job. These strikes will have quite an effect as junior doctors make up at least half of the medical workforce. Let us know what you think of this issue. What is medical care like in your country? And do you see the British NHS as a good thing or not? Let us know. Oh, and don't forget to listen to this podcast a number of times to improve your English. Enough for now. Have a lovely day. Speak to you again soon. Goodbye.